Welcome to episode 5 of the Pharmacists Matters podcast. I'm your host, Justin Bates. Since we started the podcast back in March, so much in the world has changed. We're now in month 3 of managing through the various restrictions to help flatten the curve with COVID-19. And as we start to see the economy in Ontario open in various phases and regions, now we're starting to understand the important role of pharmacists and pharmacy professionals and how they've stepped up during the pandemic to serve patients and ensure that we continue to be the most accessible healthcare provider. As a healthcare community hub, we've demonstrated our value, and the innovation and the services that have been delivered during the pandemic have really been an opportunity for us to work with patients and demonstrate not only how accessible we are, but the value that we bring to each community that we serve. As we've gone through the pandemic, we've also seen the tragic events happening in the United States and around the world as it relates to systemic racism and social injustices. We have a responsibility to continue the dialogue around addressing and understanding the barriers, educating with respect to where we are as a society, and putting forward concrete solutions to address the barriers to systemic racism. I see our role as an association and personally as a leader of the Ontario Pharmacists Association to lead these discussions and, most importantly, to listen. Listen and understand the experiences of all people of different backgrounds. And certainly as we look at the month of June, and it being Pride Month, we also have an opportunity to talk about inclusiveness and diversity across the board. By understanding and educating ourselves about the barriers, we can then start to talk about concrete solutions and what can we do as a community to promote diversity. It's with that in mind that I have 3 very compelling guests joining us on the program today, starting with Sarah Bento de Sosa, who is a recent graduate of the Leslie Dan Faculty of Pharmacy at the University of Toronto. Her areas of special interest are cardiology, LGBTQ care and advocacy, and men's and women's health. Currently, she practices as a pharmacy intern at a methadone dispensing pharmacy, at a hectic big box store, and at Cover Health, a virtual walk-in clinic. Also joining us in the program today is Pamela Ip, who is a recent graduate of the Leslie Dan Faculty of Pharmacy. She has worked primarily in a pediatric pharmacy where she has built her skills in compounding and pediatric dosing. Pam spent much of her time through school enriching student life as UPS secretary and vice president. She now holds the co-president for life for the 2020 graduating class, a role where she will sit on the Young Alumni Committee. Also joining us on today's program is Jessie Caggiarini, is a recent graduate of the PharmD program from the University of Toronto Leslie Dan Faculty of Pharmacy. She currently works as a pharmacy intern in a community setting with an addiction medicine focus in her hometown of Thunder Bay, Ontario. Jessie has a particular interest in the topic of women's health and is passionate about improving access to quality of LGBTQIA+ healthcare. I'm looking forward to learning about the intersection of care in each of your respective practices and experiences. And before we jump in, starting with Sarah, I also wanted to mention that as an association, we're taking a leadership position by establishing in the month of July a diversity task force. The task force mandate will be to meet over the course of the next several months to address and understand some of the systemic barriers, not just to the association from a governance and staff perspective, but also to the pharmacy community at large, and come up with recommendations for consideration at the board. I'm looking forward to working with that group as chair. It will be composed of 5 members who will bring unique and diverse backgrounds to the conversation. So with that, Sarah, I wanted to start with you and really get a better understanding of some of the work you're doing in this area of LGBTQ and some of the passion that you have exhibited. Perhaps we can start with the resolution that you tabled at the OPA AGM last year, and you can tell us a little bit about where all that came from.
Absolutely. Thank you, Justin, for such a great intro to the topic today. So previously, last year around this time, I presented at the AGM a resolution to support and increase our ability to have a knowledge-based practice in LGBTQ care. It's something that we don't have a lot of guidance in through our educational journey, and it's, I think, something that I wanted to encourage OPA as well as other associations to implement as part of their continuing education series. And historically, several different associations, such as the Ontario Medical Association and the Ontario Nurses Association, have put together some sort of course or show of support. And I wanted us also as an association and as a community of pharmacists to be able to show our support and as well to gain knowledge in this area to better help patients.
That's fantastic. And this being Pride Month, maybe you can talk a little bit about how pharmacists can create a welcoming environment for LGBTQ patients and how they can assist their patients through different programs and services.
One of the first things that I can say for pharmacies and pharmacists to employ would be to have some sort of signage or like flag or sign indicating that they are inclusive, LGBTQ friendly, that they know what's up. It really helps for somebody who may be unsure if they are able to approach the pharmacist with a specific question that is related to their health, that a person can feel comfortable knowing that the pharmacy team there is able to be respectful with their pronouns, how they present, maybe physically as well, maybe not being not presenting as a traditional male or female looking person. So it really helps when the pharmacy team is aware of that and is able to show that through either signage or having like a flag or having brochures and things like that. And there's a lot of organizations where you can get this sort of material from. Rainbow Health has some great resources for healthcare professionals, and as well CPHA last year put together a couple of resource tools that I actually had the chance to work on while I was a student there, where we have some posters and some tools for both patients as well as the pharmacy team to better understand and be inclusive with their patients.
I really do think emphasizing education is so critical to ensuring that pharmacies offer the care model to the diversity of their patient population. It's one of the things that, since I started OPA back in September of last year, really wanted to focus on how can we ensure that our professional development courses reflect that of the community of who we serve from membership, but also of the broader patient population. It's one of the reasons why we are launching a course providing inclusive care at your pharmacy for the LGBTQ community. And I think that's, one of many things that has to be done. I mean, there's never a silver bullet. I think there's always multiple levels of efforts that have to be undertaken. But certainly to what you're talking about and knowing that we're a healthcare community hub and a resource for patients, wanted to get your take on how do you think we're doing as a profession and also as a business from pharmacy in meeting the needs of this community? And is the gap still real? Is it something that we need to do more to address some of these concerns?
Absolutely. I still think there is a gap in care because so much of it is based on your own personal education and knowledge in the area. Some people that I've worked with or that I've talked to have had experiences where they weren't sure what to do, or they weren't sure what to say just because they had never had either inclusivity training, or they weren't sure what the right pronouns were to talk to a patient, or they didn't even know if the medication dose was correct for that particular patient because it was different from what they had seen before. Just because in some cases, when dealing with LGBTQ patients and their medications, the doses are not always on label. So it may be difficult for a pharmacist to understand why a dose is given the way it is. So I think a lot of that does come down to that there is a lack of education in this area. And it's something that I have tried to address while I was at the University of Toronto. in sort of promoting and advocating for an increase in education in these areas. I'm sure it's very difficult to build a curriculum and include everything, but in this case, I think that it's very valuable to include sort of these cases where you're having patients who have maybe a medication regimen that you won't be able to find in the CTC, or you won't be able to find if you just look it up on Lexicomp. So it's very important to me that we have good sources of education and that the knowledge there is accessible to as many people as possible, so that they can take advantage of it and self-educate.
Yeah, you raised some really good points, and I think so much of it's about awareness. And as an association, I think there's a responsibility for us to communicate these programs, and also to listen and understand, where can we provide additional services and products that will help close that gap. And these types of conversations are so important as part of the solution. And I think what we're seeing broadly in our society is that perhaps, I use this term carefully, but perhaps there's some hope and silver lining in all of the protests and attention that's being paid to social injustices, which include sexual orientation, ethnicity, and so on across the diversity spectrum, because sometimes they're uncomfortable conversations about attitudes of society and what we need to do to not only understand what advantages certain people have over others and how to essentially achieve equality, but we need to have them. I mean, as much as in some cases they're not easy, they're necessary conversations. And I think part of it is understanding what are the missing pieces and what do we have to do to drive towards solutions. So I think the work you're doing certainly lends itself to that. It's important work, and I know there's lots more that we can be doing and should be doing. So with one of the reasons and inspirations behind doing a podcast like this was to try to showcase some of the good work that's out there, but also have the conversations about what we need to do as a profession and as a sector. We have certainly a role to play and a platform. Do you see yourself continuing doing additional programs?
I'm always on the move, looking for a new sort of area to focus on or more information to learn. Right now, I'm trying to keep up to date with the latest guidelines, the latest endocrine guidelines for transgender care. So there's been some great guidelines that have come out of the US as well as BC and Rainbow Health that are all really good resources if you want to learn more. But I'm also trying to take a step back and look at things from a social lens, not just about the pharmacotherapy or about the patient care. Part of being a healthcare professional is being able to connect with your patients on a social level. And even if you don't understand their situation, it's being able to empathize with what they are going through and what social determinants of health have created sort of their unique struggles with the healthcare system. And I can tell you from experience, from friends and colleagues, when you're LGBTQ or trans, you have to access the healthcare system very differently. There are a lot more barriers that make it more difficult to access healthcare providers, contact healthcare providers that actually understand how to progress your treatment and how to get you to where you want to be. And so I encourage people to also look at resources that are less about the medications and more about understanding people. Some great things, if you'd like to watch documentaries or watch movies, there are two really good documentaries that I would recommend. There's one called Fire in the Blood, which deals with the beginning of the HIV epidemic in Africa and just talks about the difficulty in actually obtaining drugs for HIV treatment. And it really puts into perspective how much power there is in having a drug and being able to give it to people, but how difficult it is to access those drugs when they're expensive and they become almost unaffordable for the regular person. And there's also another fantastic documentary that's more about the social lives of how people sort of came together and formed communities. It's called Paris is Burning. And in this documentary, they talk about the advent of the drag scene. And it's so timely right now, where it talks about transgender people or people who identify as not male or not female and how they were treated by regular society and how they were treated by others and how they came together to form a community where they could celebrate their differences and their similarities and really embrace their uniqueness. So I would encourage everybody to look not just for the drug therapy and not just for what medications can I use, but also how can I learn about what my patients are going through and how can I learn about what my patients feel and think on a regular basis when they interact with the healthcare system. It's important to see it not just from our perspective as healthcare professionals, but from their perspective, where there may not be the same trust in the healthcare system that the average person has.
I want to bring Pamela into this discussion as well, because I know you've had some experiences with the Pharma Pride activities at the club, and maybe we can talk a little bit about some of the highlights and achievements around that. And Pam, I'd love to hear some of your perspectives on that as well.
Yeah, so back when we were still at the faculty as students, Sarah and I were actually the co-presidents of the Pharmacy student LGBTQ plus advocacy group, Pharma Pride. And some of the things that we did to try to raise awareness of the circumstances surrounding LGBTQ plus and then healthcare and being a healthcare professional and things that we can do to address the disparities between those of that society. We sort of brought in different speakers. We held a lot of different presentations to try to address some of the gaps that maybe couldn't have been taught when we were still at the faculty, or even something as simple as we have presentations annually just emphasizing the different changes in terminology or trying to understand how patients identify and just reflect back their identities to themselves. If Sarah has anything to add on as well from any of the stuff we've done in the past.
No, that's great. That's a lot of what we tried to do as a club was really to advocate what it means to be LGBTQ and how to understand what that means and what the words mean, what the vocabulary means, because it's always changing.
Yeah, it's really an inspiration that you started that club, and it sounds like you've been able to parlay that into even a much broader and greater effort. Pam, maybe you can talk a little bit about some of the factors that contribute to the structural stigma faced by the LGBTQ community.
Definitely. So stigma in and of itself is basically at its core having like an us versus you mentality. It's like identifying that there is differences between different people and then putting labels to that. So from a structural standpoint, it's mainly the policies, procedures that government institutions really have placed that have really emphasized the differences between the different populations. So for structural stigma, it's something that I actually touch upon in the module that I present for OPA's LGBTQ plus continuing education. And sort of how the lens that I took when addressing structural stigma was really breaking it down into social policies and then social behaviors, where social policies are like the rules and policies that really restrict the rights and opportunities of a marginalized group. So in this context, the marginalized group is LGBTQ plus. And I think the more common one that a lot of people know about is like blood donations and the restrictions surrounding MSMs wanting to donate blood. Although in the past, like they weren't allowed at all, there was a lot of advocacy, and now they are allowed to donate. However, there's still a lot of restrictions surrounding that as well. And then on the flip side, there's also social behaviors. So these are more like the attitudes and actions that are adopted by society or the people in society, just based on their perceived norms. The main example I can think of for this one usually is the coming out process. And the concept of how like people in the LGBT plus community, they have to reveal their identity, whereas like those that are, for example, cisgendered, that are heterosexual, living this like what we would call a heteronormative life, like this is considered normal. We don't have to come out as I'm cisgendered. I am a female that identifies as female, and I like boys, because that's just how we assume society is supposed to run.
It's fascinating, and I can only imagine the impact on mental health too when going through in some cases the conversations with loved ones and friends and so forth, and the more support we can provide and make it more of an accepted norm and remove that barrier of fear and anxiety, I think we'll be making a lot of progress in those fronts. When I think about pharmacy as being that community hub, I'm wondering if you could talk a little bit about how you think pharmacies are uniquely positioned to provide some of these optimal care models for the LGBTQ community, because, I don't know if there's that degree of awareness, and maybe there is. Maybe people will look at that as being a resource, but are there things that we can do to better market that and design the programs, and where pharmacies can play a greater role in these areas? Perhaps you can elaborate on that.
I think that at the central hub, like the pharmacies and pharmacists, as the most accessible healthcare professional, especially in times like this, we might be the first point of contact to the healthcare system that patients may face. So as the first point of contact, I think that just having a very positive experience would truly motivate their views on how they see the healthcare system. In the past, I think it was the Transpulse study. One of the studies was looking at how transgendered people, when they would actually not avoid that necessary medical treatment in the ER setting because of the stigma that they faced in the past, and those that did go overall had a negative experience. So being the pivotal pharmacy that's the first point of contact, just having that positive experience for that patient will really open their eyes and gates to the perspective of healthcare system and being able to access care. And I think that as pharmacists, that's a huge thing we can go forward with. The main things I think we can do as pharmacists to help would be to reflect on our actions, be mindful of our understanding, our attitudes. And it's okay to not understand everything, but being open to learning and having the knowledge that you want to receive to help them would be a really good starting platform. Continuing to learn would be another one. So listening to their experiences, the perspectives that they have, and acknowledging those factors. Changing our practice would be another way. So intervene if you see any offensive behaviors or language being drawn into a situation, even at your pharmacy. And honestly, just being an ally there so that they know that this is a safe space, that we are able to try to help and accommodate in any way that is possible. And then being that first point of contact so that they know that the healthcare system is there for them. And although sometimes there may be some negative experiences, overall there are positive ones, and hopefully pharmacy can contribute to that.
So common theme here is support, right? Is resources, support. And I think as a society, we could use a lot more love. And through that love, the support, that people know that they're accepted, that there's tolerance and respect. And so much of that is through the healthcare system, but, also within our family and friend circles. And I think that in part goes a long way is the education and awareness, right? And understanding and listening to the different challenges and healthcare needs. So the work you're doing is certainly contributing a long way to addressing some of those gaps. And the specific course that is being taught through OPA, can you speak a little bit about what pharmacists can expect to learn from the module and how it will be useful for their practice, especially during Pride Month? But not just for the month, but looking at their entire career.
So the module is provided by OPA. It's actually a course that's split into 4 different modules. So the first module is taught by myself, and it's basically doing an introduction to LGBTQ plus healthcare. So I'm looking into explaining the knowledge about terminology, common terminology that's in this community, and understanding how these identities are interplay essentially. I talk about stigma, structural stigma, and then I also break down some of the health disparities that disproportionately affect this population. Some of the other modules, Jessie will probably touch upon this. She's later on. She talks about transgender health. There's also one on HIV and AIDS. And then James Morrison will also talk about how you can incorporate a lot of different things into making your community pharmacy more of a safe space and environment.
Well, I'm glad you mentioned Jesse. And I know you're part of this, and you've been able to participate in the one course. But I think maybe let's start with getting your perspective and bringing you into this conversation about what is important for all pharmacists to learn about transgender care.
Yeah, absolutely. So thank you guys so much. I really appreciate the comments from Sarah and Pam as well. They're just two awesome students, and I'm very honored to have worked with them, and they inspire me to expand my knowledge of LGBTQ care. So before I start on talking, why it's important for pharmacists to learn transgender care, I do want to mention that I'm by no means an expert in the topic, but I definitely would consider myself an ally. And I definitely believe that in order to advance LGBTQ care in Ontario, we do need to all be on board. And that includes people who are in and who do not identify as LGBTQ. So with that being said, there are definitely an abundance of reasons why pharmacists need to learn transgender care. But I'd like to start off by mentioning the TransPulse project, which Pam had recently mentioned, and some of the data from the study, just to kind of put some perspective out there in terms of the experience of trans Ontarians. So for those of the listeners who are tuning in who might not be aware, the TransPulse project was a community-based research project that was conducted back in 2009 and 2010, and it collected information from over 400 transgender Ontarians. And some of the data that they were able to obtain from this community-based research related to the discrimination and the violence that trans people do experience, unfortunately, in Ontario, as well as the impacts of that discrimination on their participation in health and their experience of the healthcare system in Ontario. So that study actually found that around 1 in 10 trans people had been denied care or had care interrupted in the emergency room because of the fact that they were trans. They also found 1 in 4 people reported they had been belittled for being trans by an emergency care provider, and 21% of them had avoided the ER when they needed it because they were trans. So these statistics really show that trans people unfortunately experience healthcare in a completely different way from other LGBTQ individuals, and certainly those who do not identify as LGBTQ. And ultimately that shows that discrimination faced by trans people in Ontario leads to detrimental health outcomes. So to answer the original question, pharmacists should feel not only compelled, but also responsible, in my opinion, to step up and change this narrative to improve the experience of trans people living in Ontario and across this country and around the world. I think it's a well-known fact, as I think everyone in the chat has already mentioned, that pharmacists are the most accessible healthcare professional. So we serve as that crucial first point of contact with patients, including transgender folks. And we have the opportunity to be that positive interaction with the healthcare system, which can potentially help restore trans people's faith in healthcare and potentially increase their likelihood of, resorting to a pharmacy for advice rather than avoiding the healthcare system as a whole. Actually, Sarah had also sent me a study before we hopped on the discussion today. So thanks, Sarah. She sent me this, a paper by Rotondi and colleagues, which actually used data from the TransPulse project. And it was a case series design that helped to characterize rates of non-prescription hormone use, as well as self-performed reassignment surgeries by trans individuals in Ontario. And they found that of the people in the study who were using hormone replacement therapy, about 1/4 of them had obtained the hormones from non-prescription sources. So those things can include, friends, the internet, the street, or from strangers, and so on. So I think that really opened my eyes. So it kind of made me realize that pharmacists, should be very cognizant of inclusivity in their pharmacies, but also be acutely aware that as a result of past discrimination by healthcare providers, including possibly by pharmacists, trans patients may result to using unsafe hormones in an unmonitored environment, which obviously carries huge health risks like injection safety or lack thereof, and infection, clotting, and that sort of thing. So in a way, being well informed and knowing how to formulate treatment plans for trans folks could also be deemed kind of like a harm reduction approach as well. So I think pharmacists really have the opportunity to coach and train trans individuals, particularly trans men, on self-injection technique and needle safety. And it's a great opportunity for pharmacists to be directly involved in the care of these trans folks.
I find the stats that you started with in the outset of your conversation shocking and frankly unacceptable. I don't think there should be anybody in this province or country that would accept that gap in care and in some cases mistreatment. So I would agree with you. I think there is a responsibility for all healthcare providers and all people to mitigate that and make sure that it doesn't happen again. I mean, we're seeing things in our society, and I often remember growing up, my parents would say, you judge a society by how you deal with diversity, how you deal with the elderly, how you deal with and how you manage situations of poverty and those that are disadvantaged. All of the things that we're starting to see almost endemic in our society across the board. Look at long-term care and some of the treatment of residents. On all of these measures, we're failing. And we have to do better, particularly as it relates to the LGBTQ community, and as you've pointed out, transgender care in particular. It's gut-wrenching to hear things like that people would actually be denied healthcare due to who they are. I think these conversations hopefully lead to some of the solutions and education. But they're definitely necessary, and we need to sustain that momentum around education and awareness. Maybe you can discuss a little bit about your vision for LGBTQ plus care in pharmacy. From your perspective, what can pharmacists do to learn more, and what are some of the initiatives you'd like to highlight?
Yeah, absolutely. So obviously, being a very, very recent grad, my career is at its sort of start. So I don't have too much experience in terms of, working directly in an LGBTQ setting. But I do think that the most important way that LGBTQ care in pharmacy will advance is, like Pam and Sarah both had mentioned, as well as yourself, Justin, is that education piece. It's for pharmacists to take their own initiatives for themselves to go out and learn, listen to LGBTQ voices and amplify them. And also, reading guidelines and consulting resources that are written in correspondence with LGBTQ folks, such as, the Sherborne Health Center in Toronto or the World Professional Association for Transgender Health, or WPATH guidelines. These are really great resources that you can, take the initiative to go out and read and truly want to learn, so that you have that fundamental knowledge going forward. So doing that work to educate yourself is sort of the first step in my mind. And then secondly, walking the walk, as the saying goes, is so important. And I'd like to echo Sarah's earlier statements in the importance of showing support by putting signage up in the pharmacy. Offering LGBTQ programs at your pharmacy can really help to signal to LGBTQ patients that your pharmacy is a safe space for them to access care. So in my own, from my own perspective, living in Thunder Bay, Ontario, I have a heart for the northern communities up here and working specifically with Indigenous folks. So I really want to, in my own career, create those safe spaces and really, make it mandatory for pharmacists and pharmacies to have that safe space. And, to me, like you had mentioned earlier, Justin, it should be mandatory, and it's the right thing to do to make people feel safe and able to ask questions and approach you. So I think definitely education, and then also putting up signage and creating that welcoming space.
Maybe there's a role for the association to create some standardized messaging, signage, and I'm wondering where you think that is in terms of adoption. Not going to hold you to any numbers, but ballpark wise, if you look at, there's 4,600 pharmacies, how big is this gap in terms of creating that safe place and creating the awareness that welcoming environment conducive to patient care for all people, all backgrounds and diversities, but particularly for the LGBTQ community. Do you have any sense of the penetration of this in terms of signage and things of that nature?
Yeah, very good question. I know, for myself being from Thunder Bay, I don't have too much experience besides obviously placements in school when I was at University of Toronto working in Southern Ontario. So maybe Sarah or Pam can chime in after I kind of give my thoughts here about their experience in Southern Ontario. But I know certainly up in Thunder Bay and in this region, there's definitely a lack. I can maybe think of, one or two places in Thunder Bay that are sort of marketed as an LGBTQ focused center for education and that sort of thing. I definitely think that needs to be, again, the standard. You should, you're offering care. It shouldn't matter the person's background, their gender or sexual orientation, their race, anything like that. So I think that, at least from my point of view, in my limited career experience, I have not seen enough pharmacies visibly supporting LGBTQ individuals, and I hope to contribute to improving that throughout my career here.
Yeah, Sarah or Pam, do you have any perspectives on that?
During one of my rotations in my last year, one of the initiatives that I wanted to do was really improve the LGBTQ and safe space environment in the community pharmacy that I was working at the time. So I was looking into some of the resources or other pharmacies that may have adopted some sort of ways to signal that they are a safe space. And it was a little disheartening because it was like sort of few and far between, and majority of them really reside in the downtown core of Toronto. I think that as we venture out of metropolitan areas, it's harder for this community to really access care or even take the first step to try to find a place. Like in some of the pharmacies that I'm working right now, although we're open when they come in, there's not much that we can really provide as resources or like places that we can sort of show, tell people where to go in order to access care. Like there are places like mental health, the prep clinic, but it's hard to navigate healthcare when you're not necessarily in LGBTQ plus the community, and then it gets even more complex in this setting. And I know that like a lot of patients, they're really involved in the care, which is great. But the reason behind it is because there is not as much of a support from our perspective as well. If Sarah has anything to say about Toronto or the Southern Ontario area as well.
Yes, I think it's very few and far in between where I can think of pharmacies that I know have that big LGBTQ presence. There's a couple like in Barrie that Drew the Pharmacist has worked with to create inclusivity and diversity, and also to provide signage in the pharmacy showing them as a safe space. And I believe there's definitely quite a few in the downtown area, particularly around the Church and Wellesley area, traditionally the gay village, where there are pharmacies that are directly marketed towards the LGBTQ population, where they are able to take all aspects of care because they have that training and they have that background in it. And ultimately, I think I would like to see at least more pharmacies providing some sort of signage or open, welcome signal that they're able to, converse with patients who are LGBTQ. But it definitely requires some sort of help from like an association, for example, where you can provide sort of some standardized messaging that everybody can feel like they can post on their wall or in their window, and be confident that they can also stand by what that sign says. And that's important too. You can post a sign, no problem, but it's about standing by what that sign says and what it means in terms of inclusivity and diversity, and to be able to say, yes, we follow these principles. Yes, we can help you. And yes, we will not turn anybody away, nor will we ever ridicule you or be insensitive, because we are an inclusive place. So it's definitely something that we can work towards. And I think it's encouraging to see that there has been a lot of growth in the past couple of years, where I have seen more pharmacies popping up with inclusivity messaging, but definitely something we need to work towards still.
Yeah, I think I can see a role for the association to coordinate efforts. And as we look to launch in July the Diversity Task Force, we will be talking about issues pertaining to LGBTQ plus patients, as well as the full spectrum of diversity from all aspects, and looking at what are the ways that we can not only provide leadership, but things that will help address some of those barriers. And I think it is a multi-pronged approach, and this has certainly been a helpful conversation to shape some of the specific actions that we can consider taking moving forward. Wanted to circle back to Jesse and just perhaps conclude on the question around what people can expect from the transgender module that we're working on. Perhaps you could just talk a little bit specifically about that.
Yeah, absolutely. So yeah, Pam had mentioned that there's 4 modules in the LGBTQ healthcare course offered by OPA, and I will be doing the transgender care module, which we will definitely do a deep dive into sort of the meat and bones of the actual transgender gender affirming hormone therapy regimens. And that actually includes not only adult trans patients, but also adolescent trans patients as well. So for a variety of ages of clients that may present to your pharmacy, you will gain the knowledge of the treatment, the gender affirming hormone therapy treatment plans that you are definitely involved with as a pharmacist in terms of formulation. We also definitely review in detail the monitoring that goes behind these plans in terms of before, during, and after the hormone therapy treatment, in terms of mitigating long-term risks of the use of the medications that are utilized for trans individuals. So pharmacists do play a huge role in, not only helping to formulate the treatment plans, but also mitigating long-term risks. And we definitely do a deep dive in that as well. So I'm very excited to present that in Module 4.
This has been really helpful for our listeners, myself included, to learn about some of the initiatives that are underway. And I really want to thank each of you, Sarah, Pamela, and Jesse, for joining us on today's program and sharing some of your experiences and having an honest conversation about where the gaps exist. I think we saw or heard some sobering data on just how big this problem is. And I think it's worth emphasizing and reinforcing the need for leadership and the responsibility of the profession, of the business of pharmacy and the associations to work together in a coordinated fashion to implement solutions. And you certainly have my commitment to continue this conversation and work towards concrete actions that together as a community we can do better. And better is something that we should all be striving for. So thanks to each of you for your contributions. I do want to encourage our members to have a look at the course that is launching today, June 18th. It is all about LGBTQ plus inclusive care at your pharmacy. You've heard today at this program some of the exciting material and helpful resources that will be included. So we conclude this thanking you once again for listening to the Pharmacist Matters podcast. We will be back in July with episode 6. And until then, take care of yourselves and be safe.